What are the skills that you need to be able to evaluate a pre-ambulatory infant?
So evaluating pre-ambulatory infants and evaluating adults or even older kids' spine is a whole different skill set. And the reason for that is because not only their neurology is so much more sensitive, but the motor units in the joint, the dural meningeal system, all that is growing at such a rapid rate and so many input putting in that the system is firing so fast and is growing so fast and so quickly that you have to have a whole set of specific indicators to tell you what neurological consequences are happening, as opposed to what we're looking at structural. Like, we're not looking at structural fixation patterns, because you can't have fixation in infant's spine or infant's pelvis because there's no ankylosis, there's no exostosis, no degenerative disc disease. So they don't have fixations like we do in the adult world. But when you find a pediatric spine that's restricted or a cranial bone that's restricted, then you have to be able to determine what is the underlying structure, i.e. the dural meningeal system, that is causing that restriction, and then how do you determine where in that dural meningeal system the restriction is, and how do you make the adjustment and the correction. So it's a whole different skill set when you're dealing with the pediatric practice, and a whole different set of examination findings that have to include both structural indicators, dural meningeal indicators, neurological indicators, and all these indicators will give you a picture of how that pediatric spine is functioning or not functioning, and it also should give you a picture of whether you're dealing with what we call a primary ascending or primary descending pattern.